So as most of you know, we do have version 5 EMAR that's going to be released over the next few weeks out to all of our users. So I'm going to take you on a little tour of what the new EMAR looks like, show you some of the new features and all of that. So I've already logged into the system here and navigating into the EMAR module. Before I dive right into the new screens of EMAR, let's just take a quick review of the current EMAR that you're using right now, just so we have a comparison that we can make. So currently, this is what the current EMAR looks like. This is your MedPass status screen. These are your MedPasses on the screen. Each box represents a different pass. Most of you are probably pretty familiar with this already. When you want to start a pass, you go into your scheduled button. So this is what your pass screen looks like with all the residents that are listed. And we'll quickly take a look at an actual MAR sheet for an individual resident. So we can take a quick look, just as a quick refresher, so we have it fresh in our mind here. And this is what the MAR sheet would look like. The resident's picture being up at the top, their PRN bottle indicating they have PRNs that can be that are available for administration, their diagnosis, their allergies, their medications, the administered or not administered boxes, such as this one or this one. So just a quick review so you have it fresh in your mind what it currently looks like, so now we can compare it to what the new EMAR screens will look like. So now I'll just pop into the new MAR. So when you access the new MAR, this is the first screen you'll see. This is the new MedPass status screen. If you would like to narrow it down to a specific unit, you simply use the unit button and you can select which unit it is that you want to do your MedPass for, and it will filter the medications by the residents in that unit only. So just a quick click of a button will allow you to do that. To move to previous or next day or any specific day in the calendar, the buttons are nice and big and right at the top of the screen now. So I can go to yesterday very quickly. I can go to the next day very quickly. Or I can choose a date from the calendar and immediately pop over to that particular day. And I'll just go back to today. Sorry about that. Get rid of that for us. There we go. The big blue buttons right at the top very clearly indicate this is the hot list where you can manage your follow-ups. Your available PRNs for all residents are here. So if I wanted to just pop in here to administer a PRN without actually accessing a specific MedPass, all I have to do is click on available PRNs for all clients, select the client, and I will see all of their available PRNs. So that, once I select it, the screen will look very familiar here. This hasn't changed much. It will allow me then to select a resident, and then their PRN, available PRNs will appear in the screen, and I could go ahead and administer directly from here without accessing a specific pass time. The LOA option is available right on this screen as well. So if I wanted to put a resident on a leave of absence, again, works the same way. I would be able to select a resident from the list and set their LOA or leave of absence beginning and end dates. So nice and big right at the top of the screen. Okay, let's go ahead and access a MedPass. Now, each box, again, represents a specific MedPass. They all are color-coded to indicate which ones are in progress, which ones are scheduled, which ones are in the past or have been completed. And the same buttons appear. It's just the design is much different, much easier on the eyes as well. So again, I'll just select my scheduled meds to access this morning's MedPass. And here I am in the current MedPass, or this morning's MedPass, I should say, for today. Again, right at the top of the screen, I have my 3 available buttons for my hot list if I want to manage my follow-ups, to administer a PRN to any resident I wish, as well as my LOA options are here as well. To go back to the previous screen, I simply can click on Back to All Passes. I can easily search for a resident by simply clicking in their part of their all or part of their name, and I can search, or I can resort by default room and bed or in alphabetical order. And I will select my resident. All right, the first thing you're going to notice on the screen here is that these buttons are still available. They kind of follow you wherever you go. So if I'm in the middle of doing a MedPass and I'm on this resident's MAR sheet right now and I need to quickly administer a PRN for someone else, I have my available PRN button right here for any other resident. My hot list is here as well as my LOA for any resident if I need to set an LOA. Okay. Scrolling down a little further, we'll see Mr. Smith's information, his bed and chart number. His picture will appear here. Difference being is that the allergies, diagnosis, and diet appear right at the top of the screen, so it's very apparent, stands out. It's not hiding down that left-hand side anymore. And you'll notice that there's a couple of notes here. These are the MAR notes. I know some of these are repetitive just because we've been playing around in this training system. But MAR notes are now highlighted in blue and appear as they usually have at the top of the MAR sheet, so they're very easy to read. You'll see them right away. And the font, of course, is much bigger than it was before, so I can see right away that I need to crush his meds in applesauce. I'm going to just go down to his first medication here. The medication name, the font also has been increased, as well as the instructions, dosage, and strength, a little bit easier to read, especially for those that are using smaller tablets. So that is all increased in size. We've also now displayed the last given date and time right on the screen, much like how it was on your PRNs. Administration history will give the details of administration. So if you wanted to see more than just the last, you could still access the administration history, which shows all of the history of the administration of this particular medication. The buttons for administered or not administered have also been redesigned. As you can see here, this is my administered button. So I simply select that, indicate how much I've administered, and save. So nice and big here. If I use my not administered button and select a reason why, let's say the resident refused medication, I can elaborate and save. That will clearly show right on the not administered button the time, the reason, and any additional notes that you may have entered as far as reasons are concerned. Will show nice and big right over there. Available PRNs. This replaces the little PRN bottle that was on the old version. If I want to administer any PRNs for this particular resident, I can simply click on that and his PRN window will open up. PRN window hasn't changed, so that will remain the same for now. My hide details button is still here. It's just much bigger and easier to read. I can quickly click on that to hide the screen if I needed to step away from my computer for a second and I wanted to ensure the privacy of that resident's information, and then I could just click show details to pop right back there again. Another change is with the non-medication MAR orders, which are set up much like the MAR notes. Difference being is that I can actually indicate whether this non-medication MAR order was completed or not completed. In the previous version, the version 4, these simply were exactly like the administered and not administered buttons. We've now changed that slightly to just indicate whether it was completed or not completed. So a little bit more accurate in the description of that there, since it really isn't a medication related order, it's a non-medication order. So I can indicate if this task, let's say, was completed or not completed. So there you have your non-medication orders. Now, those are the changes to the particular design and the screens and the front end. I'd also like to show some of the new additions, and firstly, we'll start with the pop and dot. Now, in the older version, we did have an administration note. We did have our associated biotests and our body map. Now, the icons have changed for each of these, so they look a little bit different. So if I have a special administration note just for this medication, I'll add a little note here for this one. So you can see, you'll see that it lights up in blue. So it's much easier to see that a note exists on that particular medication. If I have a biotest associated with a medication, such as blood glucose test needs to be done, pulse needs to be taken, whatever the case may be, you can see that the heart will illuminate in bright red and very easy to see. If the type of medication is an injection or a patch and required you to indicate where on the body the patch or injection was located, that's the body map here, so I'll just show you what that looks like. We can see that that was the last administration, so we'll put that injection here this time. Obviously, acetaminophen is, so you can see how that will show up. But the new item I'd like to show you here is this icon here. This is what we call our pop and dot feature. This can be turned on or off in the settings, so it just depends on whether or not the home wants to make it available to their users or not. So if it was turned off or disabled in the settings, it wouldn't even show on the screen. As a user is administering medications, I'm just going to pop over to someone else's mark sheet here just for a second. Sorry about that. Just so I have someone fresh on the screen. As I pop the medication out, now this really applies to those that use blister packs or original pack, would be extremely helpful for them. As they pop the medication out, let's say into the cup that they're going to give to the resident, they can indicate that they've popped the medication out as they go. So I've popped that, I popped that one out, that's just a note, I've popped that. So if I get interrupted while I'm popping my medication into the cup and I need to step away for a second, I can come back and I can see which ones I've popped into the cup, which ones I haven't yet popped. Sometimes it's hard to remember where you left off. You may not be all that familiar with what the actual tablet looks like. So it's kind of a safeguard to make sure that you don't pop more than you should or the wrong medication. So once I've indicated all the medications that I have popped, I then can administer them to the resident. And if the resident has taken all the popped items, all I have to do now is click on Administer All Popped Items, and it will sign off on all of those. Now, it will give you messages if there's an issue of some kind. In this case, this particular medication, I did not indicate the amount that I'm administering. It defaulted to 0, and I was required to key in an amount. So it is letting me know that it did not sign off on that particular one and that I should administer it manually, which I can then do by finding that particular medication and just keying in the amount required. And there we have it. So those are some of the new features that you are going to find in the first release of the version 5 EMAR. There will still be more coming down the road, more improvements as we go. I have attached to this webinar the release notes for the version 5 EMAR, so it'll cover each of the items that I've shown you today, so you can review that release note document if you need any clarification on any of the items that will be new. And that is the new version 5 EMAR. You can see how much it's improved. Does anybody have any questions? I'm going to take the mute off for now. In case anybody has any questions, you're absolutely welcome to speak now that you've been unmuted. So does anybody have any questions about the version 5 at all? No questions? All right. We are going to be repeating the session this afternoon at 2 p.m. So if you have any other staff members that would like to join in to see what the new MAR looks like, by all means, they're invited to join. So again, at 2 p.m. today, we will be repeating the session if you have any other staff members that care to join. I'll leave the session open for another 5 minutes or so in case anybody has any questions, by all means. And I think we do have one. Oh, okay, very good question. Dwayne is asking if I can show what the program will look like if I'm running both versions simultaneously. I can absolutely do that because I am in this environment actually running both versions. So I'm just going to kind of go back to the home page for just a second. Some facilities have requested that we run both versions simultaneously, so if nurses need a little more time getting accustomed to the new version and still want the old version, when you come into EMAR, you'll see MedPass status. This is the old version, and MAR new is the new version. So I can just quickly click on MedPass status, and this is my older version, version 4. If I want to use version 5, then I've got that. But that will only be available for a short time. Eventually, we will get rid of the version 4 altogether. The default sort is always going to be in room number order. We have another question about the default sort. The sort is always in room and bed number order, and you can simply change it to alphabetical order with 1 click. Well, 2 clicks. Hard to demonstrate in my system because almost every one of my residents' last name is Smith. But you get the idea. But the search option makes it very easy to find any resident because all you have to do is start typing up even part of a name and you can see it will filter by those letters. Great. Does anybody have any other questions? Okay, I will leave the chat open for a few more minutes, or you're welcome to just ask questions since I've unmuted most of you now. So you are welcome to ask any questions. I'll leave it open for another minute or two if you have any more questions. And again, do not hesitate to have some of your other staff members join our 2 p.m. meeting webinar this afternoon if required. So I'm going to thank all of you for joining me today. And again, I'll keep it open for another minute or two if anybody has further questions. Thank you very much.
Thank you.
Okay, the hot list button. Another question about the hot list button. Dwayne, the hot list button is available in version 4 as well as version 5. And when I click on the hot list button, it gives me a list, first thing, and first and foremost, the most important thing, what follow-ups still need to be completed. So this is the button where users will access the follow-ups that are automatically scheduled when you administer a PRN, and then simply follow up on it, indicate whether it was an effective PRN or not. So I can see here that some cough medication was given PRN to my resident. I can complete my follow-up and indicate whether or not it was effective. And I've now completed my follow-up. So that is what the hot list is. It's to quickly access your follow-up list. It's also available from the Bulletin tab. So you can either go to Bulletin to access the hot list, or you can go to the hot list button. Either way, it goes to basically the same screen. Yeah, the little message that pops up in version 4 that constantly tells you you have follow-ups. We still have a reminder that will show up at the bottom of the screen, but it's not nearly as annoying, and you don't have to clear it to continue like with the old one. So it's definitely much better. It's, as you called it, the nag screen. So you still get a notification, but it's not quite as intrusive and naggy as the old one. Yes, that icon. So we have another question about that. That's not an icon. It's just a little image. That's all. So that's my resident host list, my resident PRN. It's indicating that these 3 buttons apply to all residents, rather. So you can see there's kind of multiple people in that. That's all that means. Nothing happens when you click on it. It's more for aesthetics. Again, I'll leave it open for another minute or so in case anybody has any other questions. Of course, if you come up with any other questions after the session is over, do not hesitate to give us a call. Again, my name is Vicki Gardos. You can give me a call here at Medicare at extension 282 if you need to contact me if you have any further questions about the version 5 EMR. Delaney has a question regarding reporting. Currently, we don't have any new reports. The reports will be in the second phase of version 5. And I'm not sure about status of standing orders separated from PRN. I can speak with our implementation and development team about that. I'm not sure if that, I know it's not changing in the first phase of version 5. I don't know what's coming in the second phase of version 5 as far as standing orders. But we can find out for you, let you know. Great, guys. Again, I want to thank you all for joining me today. Again, if you'd like any of your team members or staff members to join this afternoon, there's plenty of room in the webinar for 2 p.m. They are welcome to join. So again, thank you everybody for joining, and we'll talk to you really soon. Bye-bye.